Hi and welcome to Maternity KE. My name is Bayani and today's video is going to be about my postpartum experiences. Now before we get into the video, I want to remind you to like, share, subscribe and make sure you turn on your post notification because I upload videos every week and I don't want you to miss a thing. Today's video we shall be doing it in topics and we shall start with tearing. For my first labor and delivery of baby number 1, I did get an episiotomy. Now, I will share a little description of what an episiotomy is. An episiotomy is when a doctor or a midwife makes an incision or a cut in your vaginal area to help widen the birth canal in order to deliver your baby. The aftercare of an episiotomy, in my experience, was I was given a basin, I was given a packet of salt, and just instructed to make sure that I sit in a salt bath. I prepare a salt bath and sit in it for at least 20 minutes twice a day. So every 12 hours, I would sit in a salt bath, with just some warm water. Now, this is mainly just to ensure that it kills any germs or bacteria that might get there and possibly cause an infection. For baby number 2, I did have a natural tear. So it was not a tear that was made by a doctor or a midwife, but something that just happened on its own. And it was a fairly small tear, and therefore I only got 3 stitches, or what the medical professionals will call a swatch. Because it was so small, my gynecologist prescribed me with a topical antibiotic cream, which I would just apply to the swatches every 12 hours. Or when need be, like maybe I've gone for a long call, I could always just wash up and apply the topical antibiotic. With my third baby, I did not tear at all. I just had lacerations. Now, lacerations are what they call very small tears that do not require any form of stitching or swatching, and they can heal on their own. With the lacerations, the gynecologist again provided me with a topical antibiotic cream, which I'll just apply on my vaginal area to help also just kill any bacteria or germs. Now let's go into bleeding. Bleeding is the one thing for myself where I heard a lot about it and I was told you will bleed a lot. But my expectations versus the reality of it were worlds apart. With my first baby, because I really did not do my due diligence, I got into the hospital, had my baby, and then the bleeding starts and you're provided with a maternity pad. Now this is what a maternity pad looks like. Okay. Now this is not the type of maternity pad that you will be provided with in the hospital, because this has an adhesive. So if you just if you pull this paper down, you'll have the sticky adhesive side. Now the ones that they provide you in the hospital have loops. So you'll have a little loop on either end of the maternity pad. Now those loops are to help you interjoin 2 different maternity pads together. However, they do not advise you to wear a panty during this time. So you're given a maternity pad to hold your blood in, and what you're told to do is balance this. Balance this in between your thighs. You are bleeding so heavily, and this is what you're provided with to balance in between your legs. So in my first labor and delivery, I'm very naive and clueless, and I put on this maternity pad and I balance it in between my legs, and I'm lying on my bed, and then I feel like I want to go to the toilet. So I get assistance to try and get out of bed, and the minute I stand up, blood gushes down my legs and onto the floor, and it was just the shock of it, yet I am having a pad on. The shock of just seeing that much blood flow out of you and you are actually wearing a maternity pad was something I knew I did not want to go through again. So I'm standing there literally almost in a puddle of blood and I want to go to the toilet. But now I have to rethink my strategy because I need to go with pads. I need to clean up the mess that has already happened. So I'm trying to call a nurse to, kind of assist me with cleaning up the floor. I have my gown is also bloody, so I have to wait for a new gown to come. My bed is bloody. And then now I have to think, okay, I need to go and shower because I just have blood all over my legs. And I think that was one experience that I just knew for a fact these maternity pads just are not working. So with my second baby, I became a bit clever, or I did do my due diligence, and I discovered a lot on the internet that you can use adult diapers. Now, adult diapers are just have different types, but they look like baby diapers. So there are those that have the adhesive around the waist, and they're the ones that look like pants. I would always recommend the pants because they're so much easier to put on and take off. With my second and third baby, I used the adult diapers post delivery. The nurses and the doctors are like, oh, you don't need that, that's a bit too much, don't wear that. I think for them it was just maybe the breathability down in my vaginal area. But after the experience of blood gushing down my legs, I just knew, no, we can't be in that kind of a mess again. So I did buy adult diapers, the ones that actually look like, the pants type of a diaper. And it was a game changer, a total game changer, because I didn't have to worry about, oh, if I need to move in my bed, change position, will the blood, will all of a sudden the maternity pad not balance well, and I'll just be bleeding on the bed, or I have to change my gown again. It was so comfortable knowing that you have that peace of mind that you will not leak. Now, I do hope that you cannot hear my children screaming. So my recommendation, get yourself adult diapers. Now we're going to get into breastfeeding. So for myself, after I've delivered my babies, my breast milk doesn't kick in immediately. However, the hospital does provide you with some medication that will help stimulate the milk production. So I was using that for all three babies. And then I also remember that during my first delivery, I was told, oh, you don't need to wear a bra. There's no need, just keep your breast free. The bras sometimes are a bit tight around you and may, hinder the milk production. So the first time round, because I was a bit, I was a new mother, I was a bit naive, I went with that. And the subsequent consequence of that was a lot of leaking, and you're leaking into a very thin hospital gown. The gown is so thin, it is a very light cotton material. So every time you leak, it's like somebody can literally just see right through into your nipples, and I did not like that. The second time round, I came prepared, and I came with a nursing bra and nursing pads. Now, nursing bras have a little clip at the top, which will help you breastfeed properly. And the nursing pads, usually there are two types. There's the disposable and the washable ones. While at hospital, I like to do the disposable ones just so that I don't have to carry laundry home. The nursing pads will help with the leaking that does occur once your milk production does kick in. While you're breastfeeding, you may or may not experience contractions. For my first baby, while I was breastfeeding, everything went smoothly, didn't have any form of contractions or pain while breastfeeding. That was my smoothest and best breastfeeding experience. Now with baby number 2, he was what I'd like to call my most aggressive feeder, and subsequently I had a lot of contractions whenever I was breastfeeding him, especially within the first few weeks of delivery. Now, these contractions is your uterus just contracting or becoming smaller, going back to its regular size. It is stimulated a lot while you breastfeed. For baby number 3, the pain was there, but I feel it was a bit more bearable as compared to baby number 2. Now, walking and sitting. With my first baby, because I did have an episiotomy, walking was a bit more scary at the time, especially within the first few hours of post-delivery. However, I did not quite have much problem sitting down, although you're always advised, to just walk slowly. As you sit down, be very careful in case you do accidentally rip your stitches out, and then you're required to restitch your wounds or your episiotomy. I did find this fairly easy for myself. For the first baby, it was a bit harder. For the second and third, I just got up and I walked. And I remember at one point, I was walking with my dad, and he was like, "Can you just slow down? You're walking too fast." And I was like, "But I'm fine." Like, I literally did not feel any differently walking. Now we're going to talk about bowel movements. Bowel movements was another thing that I think I had very varying experiences in terms of my expectations versus the reality of it. I was told that to make sure I don't eat very heavy foods like ugali or potatoes, just in case I do get constipated, and then I do have a problem actually having my first bowel movement because it can be excruciatingly painful. Now, I have been fortunate that all 3 times I have never had any constipation or any painful bowel movement. It was, I think, just scary imagining that it could cause a bit more pain, but I was fortunate enough that all my bowel movements were post delivery went very smoothly, and I did not have to experience any form of pain. Now, let's get into the belly. With my first pregnancy, I did have this expectation that once I give birth, my belly will just, collapse and go back to its pre-pregnancy shape. And the reality of actually what you look like post-delivery, you still look about 6 to 5 months pregnant. Your tummy will gradually reduce as the days go by, but you will look pregnant for quite some time. So please do not throw away your maternity clothes. You might be using them longer than you anticipate. Sleep. They do tell you that you will be exhausted or you will have a lot of lack of sleep. The baby will be up a lot. Yet I used to find this very funny because they say that all a baby does is feed, poop, and sleep. But if the baby is sleeping all the time, then it didn't quite make sense to me. And the shocker of the amount of sleep that you actually lose with a newborn is was just I never expected it. But the amount of time that you actually spend feeding them, changing them, and then by the time they're fast asleep enough for you to sleep, you'll probably get maybe 1-2 hours of sleep before they wake up again to feed, because babies do feed on demand, and some babies cluster feed. So be prepared for a point at which you will lack a lot of sleep. My best advice is sleep when baby sleeps, and if you have visitors, you can always tell them, please hold the baby and just allow me to sleep for maybe an hour or 30 minutes. Although I must give a disclaimer, considering that we are in COVID times, having visitors may not be the best decision at the moment. With that, I would like to conclude this video. Please let me know if any of this is familiar or relatable to you. And if you'd like to share your postpartum experiences, please let me know in the comment section below. And I would love to have you on Maternity KE. So with that, until next week, bye.